disorders are linked to our new way of life. And we cannot solve that only by having a nutritionist. So we need to have a different kind of experts to talk about food, and including people who have experience in nutrition, of course, but also in immunology and psychology.
Nutrition is an amazing field because it extends from very basic science to policy. And it's really critical within nutrition to have people from different frames of reference and different expertise talk to one another so that we can learn how the bridges go from very basic science to applied science to policy. So a conference like this enables that to happen, enables the translation to happen.
I think this kind of meeting really facilitates quick learning session in a way for everyone across the board to understand the perspective from a different discipline. So for academics to understand the perspective from regulatory side, for the policymakers and so on and so forth.
The format of the Better Food for Better Health meeting, which involved various stakeholders from academic laboratories, from industry, from regulatory agencies, allows us actually to propose a holistic or integrated approach that will help develop concrete actions from our improved understanding of the mechanism underlying the links between children's nutrition and their health status.
As someone who is very interested in that connection between the food inputs that we have, how that interacts with our physiology and makes our physiology work, and how then that physiology leads us down a path of health or disease, it's almost absolutely essential that you interact with leaders in the field. So at a meeting like this, you get to meet all of the various different scientists who all see this problem of nutrition and health through a different lens, and you have the type of discussions that transform your research. You form the type of collaborations that transform your research and bring it to a new level. Meetings like this are absolutely essential to enable the scientific process to move at the most rapid pace that it can.
We can really help the policymakers, giving them information that's based in research. And this is what we keep on saying, translating the research into policy making. And this is what we are doing in this conference.
We are facing to a revolution, and now we are in personalized medicine or nutrition wave. In this field, there are a lot of new products. I hope that our symposium will help regulatory bodies to accelerate their reflection about the status of some products.
There's going to be over 9 billion people, all with different environments and settings, and how do we ultimately feed our planet in a sustainable way? And I do hope that there could be some discussions about how to not only build for healthy individuals and populations, but for the planet as well.
I think it's important for a variety of stakeholders to exchange ideas on each of the topics that we're addressing at this conference. Not just regulators and scientists, but also groups that might be affected by any of the policy decisions. And that could include, in the realm of nutrition, actors in agriculture, actors in the food industry, and representatives of consumers. So in fact, a broad range of players needs to discuss these issues.